Well, thank you all for joining us today. I'm excited to have Erica and Sammy from the Reading Coalition with us to talk about something that kind of started coming across my table with a 12 and 11-year-old daughters at home. So I'd like to thank Allison on our team for bringing this topic up to us. She had seen a similar program given by the Reading Coalition, and we were excited to share this with some of our friends and clients and hope you can get some great information out of this. So with no further ado, I'll hand it over to Erica and Sammy, and they can get going on our presentation today. Thank you for joining us.
Thank you so much, Rich, for having us. We so appreciate it. Again, my name is Erica McNamara. I'm the director of the Reading Coalition. I've worked in the field of prevention for about 25 years, and my colleague, Samantha Salkin, our outreach coordinator, is here with us as well.
So thank you again so much for having us. Erica and I are really looking forward to this presentation. And today we are going to just give you a quick overview of our coalition, talk a little bit about youth addiction, mental health, and brain development, talk a little bit about some commonly misused substances, and then of course get into some things that we can do around prevention, support, and resources for people who may be struggling with substance misuse. So the Reading Coalition was formerly known as ARCASA, and we were established in 2006 in Reading. And initially, the coalition started as a town police, school, and community initiative focusing on improving collaboration and reducing substance abuse. And today, the coalition is funded under the town of Reading within the police department, and we offer programs and services that focus on substance misuse prevention and mental health promotion. So we have a quick poll question for you all, just so we can get a sense of who's in the room. So we were just wondering, how old are your children or grandchildren or the young people that you care for? Great, and the poll should have popped up on your screen, so we'll give everybody just a second to answer that one for us. Awesome. All right. So it seems like we have a pretty good mix of people who are caring for middle school, high school age, or young adults. So before we start talking about addiction, we like to talk about why people use substances. And so a lot of these reasons go both for young people and for adults. Typically, when we ask people why we use substances, they might say, it feels good, it relieves boredom or pain, it can help people like themselves better or fit in, or of course, because all their friends are doing it. But one of the things that's really important to be thinking about with substance use is recognizing that, especially with young people, behaviors are driven by multiple factors. And we very frequently see that early use of substances co-occurs with some type of mental health struggle like anxiety or depression. And we know that everybody starts using substances for different reasons. But the tricky piece with this is that once you become dependent upon a substance and your body has that physical or that behavioral dependency upon this substance, the reason why you first started using does not necessarily matter because the disease of addiction takes over and starts driving that decision making. So when we're working with young people, we always try to help them think about what feelings drove their first use so that we can figure out what they need to be okay without using. So an example I use with the young people I work with would be if a young person says that they drink a beer when they go to a party because they're anxious in that setting, we would say, okay, so the problem is that you're anxious at the party. What else can we do to help you with that problem that doesn't involve drinking or using a substance that has these risks?
So one of the things that we also want to look at is the relationship between addiction, mental health, and brain development. So our young people actually, their brain development continues until age 24. And the research shows that young people who start drinking before the age of 15 are actually much higher and more likely to develop alcohol dependence or abuse before those who drink after the age of 21. And that's in direct relationship to brain development. If we introduce alcohol or drugs earlier into the brain development, it can cause long-term effects. We also know that youth may have underlying mental health issues, as Sammy mentioned, and sometimes they're trying to self-medicate those with substances. We often see cannabis or marijuana used to reduce anxiety. Unfortunately, cannabis can have the opposite effect and actually induce paranoia, which can create more anxiety, so it can get a little complicated. For some young people, it may work temporarily, but then it can get a little bit more challenging. We also know that alcohol can worsen depression because it's a depressant. Nicotine as a stimulant is highly addictive, but is often used to curb anxiety. We know that the research shows that 70 to 90% of current nicotine users have a co-occurring mental health condition. So that tells us that a lot of times the use of nicotine can co-occur with an underlying mental health condition. So if we can get a little bit ahead of that and notice why young people are starting to use or what feelings, emotions, challenges they're trying to manage, sometimes we can help them before they develop a dependency and get the other mental health issue appropriately treated. When we think about what addiction is, many of you, I'm sure, have heard lots of different definitions. The idea that it's a compulsion. If you know anyone who's ever dealt with the disease of addiction, you watch them lose themselves and oftentimes their relationships with their family because of their compulsion or obsession with the drug. Addiction is a disease and it develops from a variety of different sources. The sources that we know about from the research tell us that in about 40 to 50% of cases, if there is a genetic relationship to our history. It could be our environment, our culture, our learned behaviors. We live in a very alcohol-driven culture, so alcohol is used to celebrate, it is used to mourn, it's used when we're happy, when we're sad. So alcohol is very much a part of what we do in America, so that is definitely one of the pieces that can kind of coincide with some of the use that we see. Chemical dependency can increase or the risk of developing the disease of addiction, lifestyle choices, and then also co-occurring disorders. There is good news though. We do have the disease of addiction that affects a lot of people in the United States, but we know that now, because of the research and the prevention that is in our communities, more teens understand the risk of substance misuse, and less teens in the United States are using alcohol, prescription drugs, and cigarettes. And we have more teens that report having a trusted adult they can turn to at home and in school. That's really good news. And it's the result of a lot of prevention work and collaboration with our school systems across the country that has made this change. We also know that less teens are using alcohol. Compared to 1991, we only have 29% of students reporting alcohol use in the last 30 days. That's a 22% reduction compared to when I was in high school. So you can see that there's been quite a significant reduction. However, of the young people that continue to drink, their style of drinking is known as binge drinking. It's heavy drinking. It's drinking a lot in a few hours. And that underage heavy drinking can contribute to motor vehicle crashes, suicides, homicides, a number of unhealthy choices, can cause academic problems. Overall, about 14% of our current US high school students still report binge drinking. So we need to keep an eye on those young people, and we need to make sure that we're providing support and guidance, especially if they encounter one of these consequences, to maybe use it as an opportunity to redirect them and provide support. In terms of what is typical, the typical underage drinking that we see is not adult usage. Youth tend to drink to get drunk, they drink to get buzzed, they drink a large amount of alcohol in a short amount of time. They're not sipping wine or sipping a beer. It's chugging, putting a lot of alcohol into the system in just a few hours. In terms of what they're drinking, lots of things that you probably have seen around your towns. The more popular recently has been the seltzer alcohol drinks and also the combo of energy drinks with caffeine and alcohol. Young people mixing them together, which is actually mixing a stimulant and a depressant, which causes problems for young people with having a fast heart rate, as well as having a body that feels drunk but feels awake at the same time. And so we've seen a few of those cases in the ER because of that. In terms of where young people get alcohol, it's probably very similar to what you might remember as a teen, that often family and friends continue to be the leading source. We can reduce the source of alcohol by not buying for young people and not providing alcohol, especially when we know that the likely type of drinking they're going to be doing is binge drinking. Overall, parents have the most influence on whether or not their child will drink alcohol. It doesn't mean that if you say to your child, don't drink alcohol, they'll never drink alcohol. But it means that if you have ongoing conversations, honest conversations about how you feel as a parent about alcohol use under 21 in your family, they're more likely to listen to you than to any other source. And I think that's really important to have that conversation if you can with your children. I'm the parent of two college-age girls, and we also have a history of addiction in our family. So we started these conversations when they were preteens to talk about the issue because they had a family history, and for them to know that they could call me if they were in a situation or if their friend was in a situation. So it's important to have the conversation and be as honest as you can about what you expect, that you expect them to try to wait if they can, and why you feel so strongly about that. Also, if your child takes a medication, I think it's really important for them to understand the interaction of medication and alcohol. We have a lot of young people who take their own prescribed medications, and sometimes they're not really aware of the impact of alcohol on those medications. And I'm going to turn it back to Sammy to get us into talking about vaping prevention.
Erica. So in addition to alcohol, one of the substances that we know young people very frequently use are vapes or e-cigarettes. And so billions of marketing dollars were poured into advertising and marketing to try to convince us, and especially convince young people, that vaping is a healthier and safer alternative to smoking traditional cigarettes. But unfortunately, that is not at all true. And so we're going to be talking a little bit about actually what vaping is and what that means. So when we're thinking about vaping, we're talking about inhaling and exhaling an oil-based aerosol, often called vapor, that's produced by this e-cigarette or a similar battery-powered device. And importantly, vape aerosol still contains tons of harmful chemicals, including nicotine, carcinogens, and heavy metals. So the way that it works is that e-cigarettes create an aerosol by using a battery to heat up liquid that, again, contains things like nicotine, flavorings, and other additives. The user then inhales this aerosol into their lungs, and we know that e-cigarettes can also be used to deliver cannabinoids like marijuana and other drugs. And one of the things that is really tricky with vapes is that they come in lots of different shapes and sizes. So Juul is probably the most popular vape brand, and so you can see that kind of in the center of the screen. But there are also tons of other options, so things like puff bars or plus pod, which some of those are even one-time use or disposable vapes. So we see that people have, either the cartridges that you can refill, like a Juul, you can refill that, or there's ones that you can use one time. There's also products that are pretty heavily disguised. So in that sweatshirt on the left-hand side of the screen, you can see that they're in actually one of those hoodie strings is a vape product. And on the right side of the screen, there is lipstick, which again, looks like lipstick, but is actually disguised as a vape product. And one of the really challenging things is not only are there all these different products, but there's also tons and tons of different flavors. So you'll see vapes being sold of mint, cotton candy, bubblegum, chocolate, and all of these flavors, which we'll talk a little bit more about, are specifically targeted to young people. And so this is an example of vape products that were confiscated by one of the principals at Reading Memorial High School pre-pandemic. So you can see, like we said, Juul, a big player here, and that's the upper left-hand corner Juul boxes, and the kind of at the bottom down there are the Juul pods, which hold the e-cigarette juice. And so similar to, as Erica was explaining with alcohol, one of the main reasons that young people report that they vape is because a friend or a family member used them. And the second most common reason, according to the 2016 National Youth Tobacco Survey, is the availability of fun flavors, like we talked about, things mint, candy, chocolate, bubblegum. And third, the belief that e-cigarettes are less harmful than other forms of tobacco. And so again, there were tons of marketing dollars poured into trying to convince the public and young people especially that these are a safer alternative. But unfortunately, there are some very serious health risks associated with vaping. The first is, of course, that vapes contain nicotine, which we know is highly addictive, and it can also permanently harm brain development and lead to future addiction. And very importantly, studies have found that one Juul pod contains the nicotine equivalent of 1 to 2 packs of cigarettes, which is 20 to 40 cigarettes. So if a non-smoker sat down and tried to smoke 20 cigarettes in one sitting, you'd be very ill. You might be nauseous, you may throw up, headache, very dizzy. But these Juul pods are much easier to inhale. And so we're seeing that young people are actually consuming tons of nicotine very quickly without realizing how much nicotine there is. And additionally, these products are not very closely regulated by the FDA. So packaging is not always accurate for vapes. And additionally, the ingredients in vapes are not FDA approved for inhaling into your lungs. And so one of the big issues that we have seen over the past few years with vaping is something called EVALI, or e-cigarette or vaping product use associated lung injury. And this was an initiative where the CDC, FDA, state and local health departments, and other clinical and public health partners have been investigating a national outbreak of EVALI. And what was happening is that doctors were seeing, especially young people, present with a very unique and specific kind of lung damage from using e-cigarettes, but they weren't quite sure what was going on. So our health partners got together to try to give a name to this disease and this lung damage. And so as of February 18 of 2020, over 2,800 cases of EVALI have been reported, and there have been 68 confirmed deaths. And importantly, 80% of these patients are under the age of 35, and more than 1/3 are under the age of 21. And that's really significant because when we think of people who suffer consequences from a lifetime of smoking traditional cigarettes, usually we're thinking about people maybe in their 60s, 70s, who've developed lung or throat cancer. But unfortunately, we're seeing that EVALI is very common and is mostly happening in young people, or very common to young people. So in order to try to combat the marketing that was done to engage new youth users and protect the health of everybody, Massachusetts signed into law a new Tobacco Control Act, which bans the sale of all flavored tobacco products, including e-cigarettes, menthol cigarettes, and chewing tobacco. And this went into effect June of 2020. And we have begun to see a decline in youth vaping use as a result of this, which is great news. And that was the intention of this law, was to try to reduce some of the ways and some of the interest for young people in trying vaping. And so now that we've talked a little bit about vaping, we wanted to also speak a little bit about marijuana. And so, as you may know, THC is the active ingredient in marijuana, which causes people to feel high. And that works as THC overrides the cannabinoid receptors in our brains. And so we know that the more THC, then the higher somebody's going to feel, or the more effects they're going to feel from that product. And why that matters is that in the normal leaf product of marijuana, that contains anywhere between 10 to 20% THC. But the highly concentrated THC products that are vaped usually contain between 80 to 90% of THC. So again, it's a much more potent substance. So some of the things we're seeing used, especially by young people, would be something called earwax, which people use through dabbing. And this is pretty much a concentrated form of extracted resins from the leaf marijuana product. So again, it kind of becomes this very concentrated waxy substance that is then heated and smoked. Also, of course, people consume edibles. So things like cookies, brownies, gummies, or even lollipops can be laced with THC. And another form of marijuana that we see is something called synthetic weed, also known as K2 or spice. And this has become, unfortunately, more accessible online or via social sources. And this looks pretty much like the traditional marijuana leaf, but it's sprayed with a chemical, which is what makes it synthetic, and can also make it more potent and cause some additional side effects. So when we're thinking about marijuana use and the short-term effects for young people, especially some of the things we see, excess phlegm in their lungs, paranoia, nervousness, or dizziness, sometimes behavior change, and then also impaired cognitive function, both during the use of cannabis and then sometimes for days after, especially for people who are chronic users. We see that their cognitive function can begin to decline at some point. And one of the tricky things is that normally when we think about marijuana, most people think that you cannot become dependent on it. But one of the tricky things is that our studies have found that you actually can develop a marijuana dependency, especially young people who use chronically at a young age. And so we have found that the steady use of marijuana can lead to a long, slow decline, resulting in addiction. But one of the things that's really hard with marijuana use is that there frequently is not a sudden tragedy like an overdose. And there may be no visible medical problem, so it can be hard to figure out why somebody might be feeling stuck or not motivated or just off track. But our latest research states that 1 in 6 teens that use marijuana will become addicted to the substance. And further, according to the Massachusetts Department of Public Health, marijuana was cited as the primary drug of abuse upon admission to substance abuse treatment programs behind opioids and alcohol. So that's really significant that we're seeing people are actually entering substance use treatment to deal with a marijuana addiction. And additionally, for young people who have chronically used marijuana, again, starting at a young age, we have seen that they are 2.5 times more likely to develop lung cancer. It's also been linked to an increased risk for psychosis, especially if there's a family history of schizophrenia. And also people may develop cannabinoid hyperemesis syndrome, which is a condition that leads to repeated and severe bouts of vomiting. And that's because the digestive tract has molecules that bind to THC, or the active substance in marijuana, and so long-term use can actually damage your intestines. And so, as I'm sure you all are aware, the legal landscape around marijuana is changing pretty rapidly across the country, but as we stand, federal law still prohibits the use and sale of marijuana, although some state laws have enacted, some states have enacted some different laws. But currently in Massachusetts, the medical marijuana is available to people ages 18 and older, but that has to be, they have to receive a doctor's note for that, and it has to be purchased from a dispensary. And more recently, Massachusetts passed the recreational marijuana law, which requires that adults be 21 plus to purchase marijuana through an approved dispensary. And also, marijuana still cannot be used in public places, and you cannot drive while you're impaired. And so now that we've talked a little bit about vaping and marijuana, I'm going to turn it back to Erica to talk to us a little bit about illegal drugs.
So thank you, Sammy. And I can see in the questions and answers, we're starting to get some great questions. We're so excited to answer those. We're going to get through the rest of our slides, and then we will take your questions and answer those as fully as we can. So as Sammy was mentioning, we have this challenge of dealing with marijuana. One piece of good news that I can give you is that overall less teens are using illegal drugs. That includes cocaine, inhalants, heroin, methamphetamines, ecstasy, and hallucinogens. And that's good to know, because if you watch the news, you might see a lot of information about the rise in heroin and meth use particularly. And that is amongst adults, but amongst young people, the message is getting through that they need to be safe and that these are not substances that they should try. So the rates of it going down since 2001, it's actually 14% down. So that's really good news that the education can get through to our young people if we keep talking to them, not scaring them. We have to be honest with them about what we do know and what we don't know. And we need to have practical conversations with them about decision making. In terms of prescription drug misuse, this is a challenge that we face because we have a lot more young people who get prescription drugs prescribed to them and may have friends that have prescription drugs prescribed to them. So there's a lot more availability. The average American gets prescribed between 3 and 5 drugs. So we have just a lot more out in the world than we've ever had before. In terms of misusing prescription drugs, sometimes we see that benzodiazepines can be misused in opioids. When we look at who is at increased risk for misuse of a prescription drug, it's often easy access to pills, so we want to be careful about where we keep our medicines and knowing how many we should have. Early use or improper use, taking too much when they weren't prescribed that amount. Untreated trauma, if there is psychological pain, it can be very easy to use a medicine to kind of deal with that psychological pain. And then a physical injury. Sometimes pain medication is absolutely needed after an injury, but as a young person gets better, it's important to taper or wean them off the medication appropriately so that they're not taking the wrong dosage, because an improper dosage can actually lead to misuse. We do know that prescription drugs have a rapid area of growth in the opioid category, particularly for adults, but we can continue to keep the rates low amongst young people if we continue to be safe with how we prescribe medications, how we talk to them about their usage, and that they know if they take a medication, how to take it and never to share it with friends or family. There's some interesting research around youth perceptions. We do a study in our own community every 2 years called Youth Risk Behavior Survey, and that's a survey that's done all across the United States. It's administered by the Center for Disease Control every 2 years. And in our community, we ask young people what they perceive their parents would feel if it would be wrong or very wrong if they were to smoke tobacco, drink alcohol, use marijuana, or use prescription drugs not prescribed to them. And the rates were pretty high in the sense that they perceived that their parents would probably disapprove of those activities. And so you can see the rates are above 80% for the youth perceiving their parents to disapprove of them. So that means that they know what their parents think about that, which is good news. When we ask them the same question, but how did they feel their peers might perceive it? The rates are a little bit different. So you can see that alcohol and tobacco were still in the 70s. Marijuana, smoking daily, was only 43%. And so that's an area that we need to think about talking to our young people about, especially now that it is recreational use is allowable 21 and over. Young people need to understand why waiting till they're 21, especially for marijuana, because of brain development, is an important thing to think about. So that's an area that we need to do a little bit of work to get our message across to our young people. Some of the health perceptions that we deal with really do affect how we approach the issue of substance use in our family. It's one of the biggest challenges I've seen people face is the stigma of dealing with substance misuse. If they find out a child might be struggling, they're not sure what to do. However, if their child gets a sprain or a broken bone, there's a pretty clear medical path of what to do next. Typically, if a child sprains their wrist, they kind of know what measures they should take. Call the ortho, get an x-ray, maybe get it wrapped, maybe follow up with PT. If it's broken, it's got to be casted, it's got to be followed up, and there's going to be a longer stretch of PT. If it's a chronic injury, there's going to be lots of follow-up. And through all of this, typically, you would communicate with the school to say if the child couldn't be taking PE or was going to be limited in terms of their ability to be at school. And so it's a topic we feel comfortable talking about, as opposed to when something happens related to trying alcohol or trying marijuana or misusing a prescription drug. Sometimes we don't know what to do with that. We don't know where to turn to talk about some of those things. So we want you to think about, as a parent or a grandparent, what measures you could take to kind of address a situation if you catch a child drinking or something happens, you find something and you want to have a conversation. We encourage you to really think about having an open and honest conversation, not kind of brushing it under the rug. It's important to kind of have it out in the open. And then don't be afraid to reach out to your primary care provider or your pediatrician if you feel like it would be helpful for them to have a confidential conversation with their provider. Because if there is something else going on, sometimes having that extra person involved can be helpful. And also don't be afraid to reach out to your school, reach out to your guidance. They provide confidential support. It's not going to affect your child's standing at the school or anything like that. It's confidential. And we support our school as well in the community. And also you have community coalitions all across the United States, like Sammy and I, who are here to support and help people learn how to ask questions. We also try to focus on how can we help bolster our young people's childhoods and adolescence so that they can build the most scaffolding possible to protect them against the issue of substance use. There's a lot of great external assets that we as adults can provide in our communities. That's overall consistent support that we can provide, the sense of empowerment, boundaries and expectations. Most young people will say, once they're a little bit older, that they appreciated boundaries and expectations, a constructive use of time, knowing kind of how to structure their day in a way that gets them the most value. And then internal assets that we can support, commitment to learning, values that they feel comfortable with, social competencies, and a positive sense of identity. And the Search Institute is a great free resource that's available online for parents to look at the developmental asset framework. It gives you lots of great tips and tricks on how to help build that in your own family. Some of the risk factors that contribute to substance use that we want to keep an eye on if they exist in your family is a history of trauma or untreated mental health problems or emotional difficulties. The earlier that a young person can get looked at, treated, supported for something they may have experienced, the better they do as adults. There's a lot of adolescent development stressors and school difficulties, and it's important to keep in contact with your school guidance when your child might be struggling, or get an outpatient support provider. If a child's having trouble with attachment or struggling within their own family, if they have a caregiver who abuses substance or a peer group that uses substances, and then if they start using young, that can contribute to being a risk for them developing the disease of addiction. The flip side of that is strong bonds with their parents or caregiver, having parents that are highly involved in their child's life, having a sense of self-image, self-esteem, having trusted adults at school, having some academic success. That doesn't mean A's, but a sense that in a subject they're taking, they feel like that they're doing the best that they can do. Clear limits and consistent enforcement of discipline. That doesn't mean being overly strict, but having a sense of some of those boundaries and expectations. It also gives children and teens an out if they can't go to the party because they have to be home at a certain time, or they say, my parents are going to kill me, or it's not going to work. It is helpful for them to have some boundaries and expectations. And then clear and consistent messages that substance use is not something that you want to have them use before the age of 21. In terms of what you can do, learning more about how to monitor their life. It's very difficult when their life is on their phone, how often you might be checking. If you're not comfortable with that approach, that's fine, but know that if you're ever worried and you can't find out what's going on, the answer is usually in their phone. Thinking about how you show your kids and their friends how you communicate what's happening in your life when you're struggling. Do you demonstrate that it's okay to ask for help? And providing practical guidance about them being safe in other people's homes if they come across alcohol or marijuana or drugs. And then thinking about the adults in your children's lives. Are you comfortable asking them if you have concerns, or if there's a problem with their friendships, or how they feel about alcohol at under 21, things like that. And I'm going to turn it back to Sammy for resources, and then we'll get right into questions.
Thank you, Erica. And so again, one of the really important takeaways that we always like to highlight is that as parents and caregivers, you have a lot of power to support your teens, support your children in making healthy decisions. And unfortunately, it's not just a one and done conversation. These are conversations that will evolve as your children get older, as they're exposed to new experiences, but really being a consistent presence and somebody who cares and is building up your child is really one of the best ways that you can support a student from and try to help them from never misusing a substance. And then of course, the flip side of that is being open and supportive so that if your student or your child does experiment with a substance or has a concern about their own use, that you're a safe person for them to talk to, and they know that you will support them in seeking help. And so some of the resources that we recommend if you're concerned or just want to learn a little bit more, the first would be, of course, your child's primary care doctor is a wealth of information, certainly looking into licensed therapeutic support, including alcohol and drug specialists. And a lot of times your primary care doctor can help you connect with one of those. Also, Massachusetts has a helpline for treatment and support, and the resources are available both via phone or online. And also a resource Erica and I use very frequently is something called the SAFE Project, which supports young people ages 13 to 24 who are misusing substances. And these clinicians do really great work working, again, specifically with young people who have a substance use concern, and they're able to work with the individual and with the family towards coming up with a care plan. And then especially for vaping or smoking, there's some great youth-specific resources. The Truth Initiative is a great website. They have tons of information both for youth and adults, and they offer free mobile quit support. So students are able to actually enroll in that via text message and get coaching via text message or via phone. Similarly, My Life, My Quit has another option that they, again, offer support for young people via text or via phone. And then the Massachusetts Smokers Helpline does a little bit more work around smoking traditional cigarettes, but they have great resources online and free coaching available as well. So thank you again so much to Dobo Labranti for having us, and to Allison Wilcox for setting this up and making this presentation possible. This is a really important topic, and so Erica and I are really appreciative anytime that we are given space and time to speak about this, because it's not always the most fun conversation, but it's really, really important. So certainly Erica and I are also resources to you. Our contact information is on the screen. So please, at any time, if you have additional questions about what we spoke about today or are looking for some more specific guidance in accessing resources, don't hesitate to reach out to either of us.
Thank you both so much. That was a lot of info, and it was super helpful, especially for a parent like me with kids kind of entering this phase. So thank you. We have a number of questions that I'd love to go through. So
Sure,
I'll kind of read them off one by one, and
Okay.
you guys feel free to jump in and answer how you see best. So the first one is, do you think the pandemic has changed behaviors due to social isolation, depression, or other reasons?
Absolutely. The pandemic has really been an unprecedented time for adults and adolescents. And I think the biggest challenge, particularly for teens, has been the inability to gather together. We have seen some substance use rates go down in terms of youth gathering to do parties. Obviously hasn't been happening. Youth were gathering in much smaller 2 or 3 people together, if they were even allowed to by their families. So we did see some rates go down, but we saw an increase in young people feeling isolated and feeling depressed. And so that's one of the challenges that Sammy and I have been working with our local school system this year, and trying to provide support to the folks that support our young people, our social workers, our guidance counselors, and try to provide as much professional development and training as we could to help them navigate this unprecedented time. But absolutely, young people have felt it quite deeply. I think one of the things that I've also heard from young people is that because they were pretty savvy with technology, they were able to keep in contact and do a lot of stuff together with their friends virtually, whether it's video games together, texting all the time, FaceTime. They were much more adept at that much quicker than a lot of us. So they still were able to maintain some of those relationships. But there are some young people who just really struggled with the lack of being with people, the socialization, as many of us as adults have. So it's been a challenge for sure.
I can imagine. Thank you. The next question, are parents buying THC products as well as alcohol for their children? Do you find that being an issue?
We haven't seen as much purposeful buying for their teen. We have seen older siblings perhaps buy things for their younger siblings. We've seen children take things that belong to their parents. And so that has brought up the conversation of, if you are a marijuana or cannabis user over the age of 21, protecting those products from children, particularly children, pets, and adolescents, because there have also been poisoning cases with pets as well. So we haven't seen a huge surge with that, with parents feeling comfortable buying those products. But it is important to think about that, if, in terms of the brain development for the child.
Great, thank you. The next one is, can teens order vapes and flavored products through mail order if they are underage?
So unfortunately, yes, this is something that is just very hard to regulate. So it's not technically allowed, but the regulation on mail orders is not so great and very difficult to enforce. So we have seen that young people are able to order things through mail, also drive to neighboring states and purchase flavored products, even though they were banned in Massachusetts. However, recently the FDA and the Biden administration announced that they were going to be making some changes to ban the sale of all menthol cigarettes and also flavored vape products. So it'll be interesting to see, once this legislation goes nationwide, if that will hopefully really, really reduce access, especially for young people.
We definitely have seen a huge reduction with the Massachusetts law change. Although young people can still access the mail order, we've seen a reduction in casual use. So young people that wouldn't necessarily have gone through the effort of ordering it online, who just might have had a friend that had it, we've seen less middle schoolers starting to use because of the Massachusetts legislation, which is good news. The Mass Attorney General did put a lawsuit together to fight the mail order issues that were happening, because what they found is that young people were being delivered these products. And actually a private school in our community tested the theory by ordering products to the Austin Preparatory School just to see if maybe they would check for ID. And unfortunately, Jewel did not check for ID. So it's part of the lawsuit that's pending right now. So, there is an attempt to fight it, but it's a challenge.
Great, thank you. That was a smart trick to try there. How are shops in Massachusetts monitored for compliance with local laws on sales to minors?
That's a great question. Compliance is actually done through what we call undercover compliance checks, and young people over the age of 18 are trained on how to make a buy. And they also have known compliance checks where an agent goes in and does a formalized check. So there's a use of both of those techniques. One, to make sure when the agent goes in knowingly to the store, that's to make sure that all the signage is correct and make sure that the material that's being sold was bought through a wholesaler and brought appropriately and is taxed appropriately. The undercover buys are meant to catch not checking IDs and things like that. So we use both techniques in our community. As a whole, during the pandemic, those compliance checks did actually continue in most communities. It depends on the structure of your public health department. Some were pulled in different directions because of the pandemic, but I know in our community, we continue to have our compliance checks. And for the most part, 99% of retailers are compliant with the law.
Wow, that's great. Isn't synthetic extremely dangerous, as you really don't know what is in it? Is it true that it could be soaked in product or like gasoline?
It's true that it's unknown. We've seen a lot of different types of synthetics and a lot of different smells. I've never seen the gasoline. We have heard from our local ED physicians that they've had a few cases of the synthetic marijuana where a young person got very ill, vomiting, and then also had a fast heart rate and some of those psychoactive symptoms where they were feeling out of sorts. We don't see a ton of synthetic marijuana use, but we want to make sure that we shared that so people know that it's still one of those things that people can get online. And also because it's labeled as potpourri, it's technically allowed to be sold in the United States, but it's not supposed to be ingested. So it's a product that will be ingested, but it's sold as a product that's a novelty or a non-ingestible product. So to me, it's just a loophole. And we've definitely advocated to the FDA that that needs to be taken care of, that this is a dangerous product for our young people.
And that remains true with all types of marijuana and other substances. And that's certainly something to also be talking to young people about, is not only should they not be using these substances until they're an adult because of the role that it can play in brain development and that it can actually cause them some very serious harm if they begin using substances early, but also the idea that a lot of times you may not know what's in something you're purchasing. So definitely talking to young people about being careful, of course. Yet another reason not to be using these substances is also because we really have no way to be sure that you're getting what you think you're getting. So just again, another reason why these substances can be very dangerous.
Great, thank you. I've heard that prescriptions, especially ADHD, are sold from teen to teen. Is this a growing or diminishing trend as far as you can tell?
I would say it's about status quo right now. We haven't seen an increase. At the high school level, it's less common than we see at the college level. We see more abuse of the drug and sharing with young people at the college level. And partly that's because that's sometimes the first time where a young person becomes aware that their medication has a dollar value. And so that's why I always encourage people, and I have people in my family who take that medication, and we've had the conversations to make sure that they know that that medication is very important for their well-being, and it is not something to trade no matter how much money someone offers you, and that could prevent them from getting another prescription and they would be unable to have the medication they need. So it is important for young people to understand the danger of either sharing their medication. Sharing a pill is the same as sharing cocaine in terms of the law. So the legality of it makes it illegal immediately by sharing it. But also if it happens at the college level, it can affect their housing, it can affect their financial aid, and it can affect a lot of different factors that we wouldn't want them to be dealing with. So we always encourage young people to be very careful and to only get a small amount of their prescription at a time. It can be a lot easier to get a longer prescription, but particularly for stimulants, they're usually only prescribed 30 days at a time. And there's a reason for that because of the abuse of the medication. So encouraging young people to have a lockbox if they're at college, know how to manage their medication and never to share their prescriptions.
Thank you. The last question is, do you let teens know if they can confidentially contact you about a peer?
Absolutely, and that's one of the things that we work very closely with our school system about, is just making sure that students know that there is non-judgmental help available. So very frequently when Erica and I are made aware of a student who's struggling, that typically comes through the school, as most students feel maybe more comfortable with a trusted teacher or guidance counselor who they see more regularly than they would see Erica or I. But absolutely, we work with students and with families to try to provide support, and especially if a friend, if a child is worried about their friend, that's certainly something that we will get involved in and see if there's any type of support that we can offer. And one of the things that's really important with that, working with both young people and adults, is helping to build somebody's readiness, because making a big change in your life is hard for everybody. So if somebody, for example, is vaping, quitting vaping is really challenging, or it can be, especially as we talked about with the nicotine, it can be very addictive, as well as you become behaviorally dependent upon that. It becomes a part of your day. So making a really big change like that can be really challenging. And it's possible that maybe that teenager isn't quite ready to do that today or to start the cessation process today. But Erica and I work very closely to make sure that students know that there are resources for them whenever they're ready, and that we'll try to help them, move them along in that process of becoming ready, so that we can help them with that quit attempt and make sure they're connected to the appropriate help.
That's wonderful. Well, thank you for the great work that you're doing in the community. Like we said, this was wonderful information to share, very important, very helpful. Thank you to everyone who joined the call today. We will have a replay available, so if you have some folks that could benefit from this, please feel free to share. But a huge thank you to Erica and Sammy. Really means a lot that you joined us today, and we appreciate your time and your expertise. So thank you all, and enjoy the rest of your day.
Thank you so much to everyone that attended. We so appreciate it.
Take care.
Thanks.